morning. Just give me 1 second. Feel free to take a seat. Lovely. Okay. What's your name, please? Just to double check your credentials and everything. And your date of birth, please. Perfect. Okay, right. Just making sure I got the right person, that's all. Okay, right. So, let me just get... Well, you're a bit earlier than I was expecting, so I just want to get a mask on, some gloves and an apron, if that's alright. Lovely. It's just all of the things we have to do now. Just tie that up. Okay. And my gloves, oh there they are. Okay. In fact, I'm going to put my mask on and then put my gloves on if that's alright. Do you mind me wearing a mask? I assumed you'd prefer me to because it's... I have to get a little bit close up to your face, okay? So I just want to make sure that you're protected as well as me, so if that's alright. Quite crispy, these ones. They got a bit of sound, a bit papery almost. But I have to twirl the ears because they're a bit too big for my face, so I have to twist them just to make sure that I've got it on securely. I think that's alright. Alright, and then gloves. I thought it would be better to do it that way because otherwise I'm going to touch my face with the gloves on, so... Okay, there's one. And I would normally have done this before you get here, but like I said, you're a little bit earlier than I was expecting, so... What's going on with that one? Lovely. Okay. Just move these bits to the side quickly. Just get them out of our way. Okay, just pop this on now. There we go. So, right, you're just here for just a general checkup. You haven't got anything sort of in particular that you're concerned about. I just need to do it, just a general check of your face. Yeah. No obvious swelling or anything. I'm just going to check your glands, okay? So, yeah, just a general health checkup. That's good. It's really important that we do these regularly. Ideally, sort of once a year, really. Just lets us know if there's anything that is changing or anything, you know. We're all getting older, as much as we don't like it. So, you said there's nothing really noticeable, like obvious to you, that's changed. Your eyesight's all okay, and your teeth. Okay, you feel like your breathing's all fine. Just going to scribble these bits down if that's alright, just to make sure I don't forget any information. I might get my pen to work. Is that right? Because I tested them all the other day and they all seemed to generally be fine, and now suddenly that's the second one that's now not working. It's just typical, isn't it? Anyways, okay. So, right, so we've said general health seems fine. Okay. And nothing noticeable that you feel concerned about. Okay. So, I was asking you about your eyesight. You think there's a slight change, do you? Okay, well that's fine. As I said, we get older, things do change, hence why we like to do these checkups once a year. In what sense do you feel like it's changed? Okay. Which eye is it? That one. Okay, right. So it's a little bit blurry, but not enough to stop you from working. Okay, but I assume you're getting headaches and like eye strain and things like that. Okay, are you getting any pain behind the eye? Like not eye strain, but like a pain, like a pressure pain almost. Okay, and sort of how frequently would you say that is? I think it would be worth you having an eye exam at some point. Not today, we won't do that today. Because you need to have like a cranial nerve exam type thing. I think that would be worthwhile doing. Just a general eyesight test as well, just to make sure that your prescription hasn't changed too much. It certainly sounds like it has changed, but that's fine because that happens. As we said, when we get older, I used to have perfect vision. I've noticed changes in mine. I need to get myself tested too, so it does happen. Like, that is normal, don't worry. But it's important that we give ourselves that time to go and get ourselves checked out like you have today. So good on you, well done you. Okay, we don't give out stickers anymore, unfortunately, so otherwise you would have had two. Okay, so that's your eye exam. So your teeth. Is your mouth feel fine? You haven't been having any toothaches or just anything particularly concerning at all? No? Okay. Well, I'm going to look in your throat anyway. I'm going to have a look in there. I'll do a little basic sort of thing with your eyes as well, but otherwise, yeah, I mean, teeth and things, I don't deal with that. I'd have to refer you on to somebody else. But you say that seems all fine. Okay. Just mouth ulcers are really common, especially when we get stressed. Obviously, if you get a lesion or something, like you bite yourself whilst you're eating food, that tends to cause ulcers and things like that. It's perfectly normal. Just stick some Bonjela or something, or salt rinse. Salt rinse are really good, so something like that. But yeah, we do just sometimes get, if we're run down or if we've been stressed for a long time, that causes us to be run down. That's when you're going to start getting things like mouth ulcers and things like that. Okay, so don't worry about them. I think if you're getting them for long periods of time and you get to a point where it's stopping you from eating properly for like weeks at a time, then that's really important that you come back and talk to us about that, because that suggests that there's something else going on. Okay, and you shouldn't be that stressed. All right, but just the odd mouth ulcer is fine. Your ears, are they all okay? Yeah. Okay. And you think your hearing's all fine? Okay. That's good. Again, that's not something I deal with, but I can refer you on to. This is just a basic health check, or just to catch up if you like. How are your stress levels actually? Whilst I think about it. Okay. And what do you do for a living again? Okay. So I think it's quite stressful, I imagine. Right. Would you say you feel particularly stressed a lot of the time, or is it just a sort of here and there kind of thing? Okay. Well, there's plenty of exercises and things that you can do to keep yourself calm and sleep well. Do you think you're sleeping okay? Well, there's a lot of anxiety around at the moment, isn't there? I mean, everything's changing. You know, we've gone from being locked in for a long period of time and not really being able to get out and do anything, let alone see anybody. So, you know, it's a big change at the moment. So I completely sympathise with you that you're struggling about the prospect of getting back out there, because it does feel like everything's suddenly open again. And over the space of the next couple of weeks, suddenly, bam, like you can suddenly go to the gym and go to the cinema and like go and see your family and all that stuff. So it's quite an overwhelming thing. But you just go at the pace that you need to go at, alright? You know? You just do what you feel you need to do. So I'm just going to make a note and just say that you're feeling a bit anxious about the world, basically. But I completely sympathise with you. Like, I am feeling exactly the same. So, you know, it is scary. But hence why I'm wearing the mask and the gloves, because I don't want to take my chances and I want you to feel as comfortable as possible too, alright? Although the masks are quite an aggressive thing, I think. They're quite a barrier because you can't read people the same way, can you? But you're okay. Right, so the next things to do would be to check your breathing with this. And I'd like to check your pulse as well, if that's alright. I don't actually have my blood pressure machine here at the moment. It's actually being used by another doctor at the moment, so I can't do that. I can check your pulse, and you'll just have to come back another time and we'll do that then, alright? It's okay. Right, so I just need you to stay completely calm, which is easier to say than do when you're in a doctor's surgery. I appreciate that. Just be as calm as you possibly can, and I'm just going to place this, just check that it's not too cold. No, it seems alright. I'm going to place this on your chest, and then we'll just go from there. Okay, I'll probably get you to take some deep breaths, but I have to instruct you. Okay, don't worry. I'm just going to pop these in. Okay. Bear in mind, I can't hear a thing you're saying right now, so I don't know. Just wave if you need me, because I can't hear because these are in. Okay. It might be a bit cold. Right. I'm just going to put this on your shirt. Sorry, I said it was cold. Okay. If you just I'm just going to place this hand on your shoulder. I just want you to take a deep breath in for the count of 4, okay? 1, 2, 3, 4. And just hold it there. And breathe out. And again. 1, 2, 3, 4. And breathe out again. Okay. I'd just like to come around onto this side as well, okay? And I'm just going to place my hand on this shoulder, okay? Now I'd like you to breathe in to the count of 4 again. 1, 2, 3, 4. And breathe out again. I'm just going to move it down a bit. And breathe in again. 1, 2, 3, 4. And hold it there. And breathe out again. Okay. Sorry about that. Now, there's nothing really that's standing out to me that makes me feel concerned or anything. Your airways all sound fine. No crackling or like congested sounds or anything, so that makes me feel better. I'm just going to make a note, okay? Just document that. And listening to your heart as well, everything sounded fine there. unless you've got any concerns. No? Okay, that's fantastic. Okay, no, everything was fine there. Okay, so the next thing I'd like to do is just have a look on your eyes. If you just like to follow my light, I'll just do a little bit of a, I'll probably get you to look at my finger, and then I just move it across. I just want to see your pupillary reaction, and just make sure the muscles in your eyes are working okay. Alright, so it's quite bright. I'll be just warn you about that. If you feel uncomfortable at all, just let me know. However, I'm quite confident that you've had this test done before, so I know that it's not alien to you, I'm sure. But it is quite bright. Alright, I won't go on for too long. It'll be quite a quick test. Okay, so I'll just check that's working alright. So I'm just going to start by just running it across the front and just seeing your general reaction from your eyes, okay? So you just relax. You just look at me and just keep yourself sort of steady, okay? So we're just going to go steady along. Okay? And I'm going to just bring it back along again. Okay, that's fine. Right, now I'd like you to just look at my finger. I'm going to hold my finger. I'm going to hold my finger right here, so it's not too close to you. And I'm just going to bring this across. Okay. Just for your right eye. Okay, and now for your left one. Just keep focused on my finger. That's great, thank you. Okay. Alright, so if you can just follow my finger up, okay? And then down, and then to the right, and then to the left. Okay. You can just follow my finger. So we just go up, and then down, and then right, and then left. Okay, just do it again, okay? Just follow the tip of my finger. So there, to there, to there. Okay, I'm quite happy with that. Whilst I've got my torch on, I'd just like to have a look down your throat, if that's alright. Okay, so I'd just like to open your mouth for me, okay? And just relax your tongue, just let it fall to the bottom of your mouth. Open it as wide as you possibly can, okay? And I am just going to do an initial inspection with the torch, and just have a look around. And then I let you close your mouth, swallow again, and relax. And then I get you open it again, and I put this on your tongue, and I look down your throat. Perfect. I'd just like to talk you through what I was going to do, okay? Just so you know what to expect. Okay, so if you just like to open your mouth for me. Okay. Lovely. Right. Nothing sort of majorly standing out to me. Just a little bit of redness. Like you said, you'd got some mouth ulcers and things, didn't you? Okay. Yeah, they don't look infected or anything. I'd just say keep using the mouthwash. Just keep using a mouthwash just to keep them clean and disinfected, alright? They should heal up in no time. Try and avoid things like salty foods and sugary foods. Just try and, like, fruits and things are very sugary. Sorry. So as much as it's good for you, try and maybe avoid those, and like acidic as well. So try and stick to fairly plain foods like bread and things like that. Okay, just to avoid aggravating it, basically. Okay. Right. Oops. Right, nothing's really standing out to me to be concerned about, which is good. Okay, so just close your mouth, have a quick swallow. I'll just give you a minute just to feel a bit more comfortable. I'm just going to note down about your eyes. Lovely, lovely. Okay. So if you'd just like to open your mouth again, just going to pop this on the bit of your tongue. Just a wooden stick, like a lolly stick. Okay, nothing unpleasant. Just breathe steadily through your nose, and that'll help you feel a bit less gaggy, because it's not a nice feeling, is it? Okay, ready? Okay. All right. I know it goes really far back. Just breathe through your nose, okay? Okay, right. If you could just say ah for me. And again. Okay. Nope. Everything. It looks fine in there. Just dispose of that. Looks tickety-boo. Okay. Lovely. That's really nice, actually. Okay. So, right, the next thing would be just having another feel around your jaw and things. Check there's nothing swollen or anything, inflammations. No, I just want to have a quick look on your ear, okay? I can't see anything in here that is concerning at all. Okay, I'm just going to look around the other side. I thought I won't whisper in your, I won't shout in your ear. If I whisper, it'd be a bit more pleasant for you. Okay. Okay. Have you been to see Dr. Sarah? She's the expert at cleaning ears, honestly. I thoroughly recommend you take a minute to go and visit her, because she'll clean your ears well and good. Okay, right, well, I'm quite happy with what I've seen here today. And if you're not concerned about anything, then I don't see why we need to see you back here again anytime soon. I would recommend you seeing somebody about the eye. Do you want me to just have another close look at it? Just a bit of a close-up. Just want to make sure that there isn't any infection or anything. I don't think there is, but we'll just have a look. And I mean, it looks maybe like a little bit pink. I don't think there's anything to get concerned about. Just have a look on that side as well. No, I mean, that looks fine. I think that looks fine. Sorry. I'm very close to you here. I mean, if you're uncomfortable, just say. Okay. Right. No, I think everything looks alright. I think we just get it checked. We just have an optician's appointment. They'll be able to very quickly tell you if your prescription's changed and about the pain in your eye and everything, because they look right at the back of your eye, so I wouldn't worry about it. Okay. Alright, well, it's been lovely to see you. And yeah, if anything changes or you feel a bit anxious about, well, more anxious about things or any health issues, please, please, please come back and see me as soon as. But I'm quite happy to send you away today because I think you're okay. And I think you needed a chat too, didn't you? You needed to talk about the fact that you're feeling a bit anxious about things. Okay, well, just know that you're not the only one. Many, many people are feeling anxious about what's going on in the world right now, and that's perfectly normal. So it's so good to talk to people about it, you know? There's so many people. So, and a problem shared is a problem halved. So, yeah, that's all you can do is keep talking about it. But like I said, if you feel like you're struggling too much, come back and we'll see what we can do for you, okay? But just know there's one less thing to worry about because your head looks good. Alright, okay? Well, I'll see you again soon then, alright? Okay.